Let's talk about why you went to grad school. What is the purpose of going to grad school as you in your position as a student, and what is grad school's goal for you? Okay, so obviously you want to be a professional that needs a license to practice. You have to go to grad school in order to get a degree, in order to sit for boards and get your license. So the reason why you went to grad school is because you want to be a DPT, a DC, OT, whatever it is. You have to get a degree in order to sit for the board. So that's why you're going to school. Why is school there? Because they want to take your money in exchange for giving you one of these pieces of paper. That's it. School's goal is not to help you differentiate yourself. School's goal is not to turn you into a critical thinker. School's goal is not to teach you how to be elite. That's not what they want to do. They want to churn out people that can pass boards. They want to churn out people that will pay them to get a piece of paper. So, not saying that's bad, I'm just saying that's their goal, and that's the truth. So if you want to be elite, you are going to have to do more than just show up to school, get your piece of paper, and take your boards. So understand that the people that are your professors in school went through the same programs, got the same thought processes. If they are practicing PTs, most likely, I'm 99% sure of this, they are practicing conventional PT. All the things that you listed on that piece of paper a couple modules ago. So that's the only way they know how to think. So I'm not telling you that they're trying to screw you over. I'm telling you they can only teach you what they have experience doing, and they do not have experience churning out critical thinkers or elite practitioners. That's not their job. That's not their thinking. That doesn't even cross their mind. If you said, what is an elite physical therapist to PT school, they would probably tell you that you have a bunch of certs, which 99% of the certifications out there are complete garbage, or that you've got this great body of experience. You took courses from the myofascial release guru and that guru and that guru, which is all old school medical model crap. Or maybe you work with a professional athlete team. None of that stuff makes you elite in my book. What makes you elite in my book is setting the bar so high that only you can reach the goals that you are doing. You're the only one that gets the results that you're getting, because everybody else down here is swimming in the pool of mediocrity. So we're going to take you out of the pool of mediocrity, teach you how to take apart your thinking, and get up here to the elite level. So understand that when you go out on your rotations, when you take your courses, when you do continuing education, if you take a residency, that is all built inside the conventional medical model, which will fail, which will make you chase more medical model crap when you get out, which will make you a slave to an insurance company or a PT mill, or get out, think you're gonna do cash, and you do cash, and guess what? You're doing the same thing that the guy in the PT mill is doing. You haven't differentiated anything. You're just in the same system. So here's what PT school will not teach you how to do. They will not teach you how to think critically, which is what we're gonna go here in a little bit. So I know that everybody says they are critical thinkers. That's not true. So critical thinking is actually a system that was come up with by people who teach critical thinking courses. I had no idea about this when I put the 180 system together and I was working on all these things. I had certain things that it was built on. Fortunately for me, my wife was going through critical thinking training through the Critical Thinking Institute, or the Institute of Critical Thinking. So when she looked at what I was putting together for my course, she said, you're using the components of critical thinking. So that's what we're going to talk about in a little bit. So it's more than just saying I'm a critical thinker, because I've seen this on Instagram by old school PTs telling people they need to think critically. And when you actually look at what they're doing, it's got nothing to do with the way you learn how to think critically through the Institute of Critical Thinking. So that's the window that I'm going to show you. I'm not going to show you everything because my wife took their courses for 2 years. She now travels the world teaching critical thinking. It's not a 1-hour course. It's not something that you take in a weekend and then all of a sudden you have quality thinking. It's something that you work on day after day after day. She's been teaching it for years to all different kinds of professions, and she will still tell you that she still has to work on her thinking every single day. So the good news is you're taking this as a student or a new grad, so it's going to be easier to unwind your thinking and get out of the broken model if you don't have 15 years of this crap to dig out of and then retrain your brain to think a different way. So understand that when I'm talking to you and we're talking about clinical things, I'm thinking the exact opposite of what you're thinking because I'm using the opposite thought process, which is hard for me to engage in some questions because I have to revert to the way you guys are thinking. But when you send me questions, that's what I do. I have to think back, okay, now wait a second. They don't understand what they're talking about here because they're thinking old school PT wise, and I'm thinking critical thinking wise. So we're gonna get through that, but I just want you to understand that PT school is not churning out elite practitioners. And if you get out of PT school or DC school or ATC program and you think you have it made because you got your degree, your little piece of paper, and you passed your boards and that's all you need to know, you will be stuck in a job of mediocrity and will never have a career as an elite practitioner. So here's the wrap up. You went to school to get one of those so you could take boards and get a license. That's it. School didn't make you elite at anything. It made you extremely average. It gave you the basic information and did not teach you how to apply the information because remember, school's job is not to make you an expert clinician. It's not even to make you an average clinician. It's to make you an average information gatherer, information regurgitator, so you can get that and get a license. From then on, after you get your license, how far you go is up to you. And hopefully you can find a mentor in a community that helps guide you through so you don't have to do what I did and struggle for 2 years putting everything together. So if you want to be average, you're right where you need to be. You just want to have a job that you can show up and get a paycheck. Patient success, patient results, not a really big deal. You work in a mill that's owned by physicians. Physicians really don't care if they get any better with PT because then you'll refer them back to them for more injections, more surgery, more imaging, more garbage. So the patient gets strung out. If you don't care about that, then you are perfect where you're at. You probably shouldn't watch any more of these modules. Take your basic CEU courses so you can keep your license going. Go hike and bike and screw around with your friends on the weekends. Watch Netflix after work. Don't put anything into your professional development. If you want to be average, that piece of paper and your license got you there. If you don't want to be average, if that wasn't enough, if your license wasn't enough, if you want to get results with your patients, especially if you're trying to work with a niche of patients, whether that's pregnant mothers, professional golfers, dancers, youth athletes, whatever it is, if you have that passion, you're going to have to do more than that. And you're going to have to figure out how to take the information that you learned in school, which was the correct information. It just wasn't ever given to you in applicable format. So now you're struggling to become elite and you're stuck in the mediocre range. And odds are, if you're working in a clinic with 2 to 6 other therapists, they're probably very complacent, very happy with mediocre, and they're not going to help you get anywhere except down to their level.